Well, the nation's peak dementia organisation says 7 in 10 aged care residents are living with cognitive impairment, yet their carers aren't required to have formal dementia training. This week, Dementia Australia wrote to the Coalition, Labor, the Greens and Independents, asking for clarity on what they will do to implement the findings of the Aged Care Royal Commission to deliver quality dementia care. Joining me now live is Dementia Australia CEO Maree McCabe. Maree, great to see you. Thank you very much for joining us this afternoon. It has been more than a year since the Aged Care Royal Commission. How much has been done during that time, do you think, to improve the sector?
Well, Danica, I'm here today calling on all politicians to ensure that aged care and dementia are election priorities for this election. And there has been significant investment in the aged care industry since the Royal Commission. Aged care reform is underway, and there are 3 key areas that Dementia Australia is calling on to ensure that they are fulfilled. And the thousands of people that participated in the Royal Commission need to know that their voices are heard. The key areas for Dementia Australia are around mandatory education for all staff, and you mentioned that 7 in 10 people in aged care are actually living with moderate to severe cognitive impairment, and of the 500,000 people in Australia living with dementia, 70% live in the community. And we need to ensure that our aged care workforce is supported, is well equipped, with information, with education, to do the best that they can do to care well for people living with dementia. The second area for us is around palliative care. We all want a good birth, and we plan for that. We all need to plan for a good death. And for people living with dementia at end of life can be a very difficult time if they are not able to express their wishes. And we need to ensure that people living with dementia plan early, that they have the care that is important to them and the people that are important to them, and that they have a pain-free experience. The third area are dementia-friendly communities, and these are communities where people living with dementia are included, they're engaged, doing the things they love with the people that they love. They get a say in the community and they get a say in what is important to them. So they're the 3 key areas for this election for Dementia Australia, and the 3 areas that are not yet fulfilled from the Royal Commission recommendations.
I want to speak about education. I guess it's almost surprising to hear that there might be such a lack of education out there. Is it not a legal requirement for dementia-specific training in the aged care sector?
It's not, Danica, and it is so important that people understand the disease that dementia is and how it can manifest, and then the experience people can have. And the experience of somebody living with dementia is very different from our own experience. And it may be that they have perceptual disturbances where they can't distinguish colour. So if colour is very similar, they can't tell the table from the chair, and things like that can increase falls in care, both in the home and also in residential care. They can also have experiences where they see illusions. If lighting casts shadows, then they can perceive things in the environment that are not there. They may not be able to express that they're in pain. And if people try to move them and it causes pain, then the person may lash out, not to be aggressive, but because what's happening is exacerbating the pain that they have. And then unfortunately, that person is then labelled as aggressive, when in fact what they're trying to do is to prevent further pain being caused.
We're only 2 weeks away now from the federal election. So far, do you believe that enough has been done or announced in the aged care sector?
Well, what we would like is that when politicians talk about aged care, they must talk about dementia. It is such a fundamental part of business for people living in aged care and also in the community. And we cannot assume that talking about aged care will actually translate to better outcomes for people living with dementia. And a lot has been done. And we are really grateful for the work that is being done in aged care at the moment and the funding that's been provided. But we have to understand that we must continue to have dementia front of mind. It's got to be a priority that our politicians talk about, and people living with dementia, their families and carers, they need to hear that from our politicians.
Maree McCabe, we have to leave it there. Thank you very much for joining us this afternoon.
Thank you so much, Danica.